Harriet Hopf. I'm professor of anesthesiology and biomedical engineering at the University of Utah. My research focuses on actions anesthesiologists can take to reduce healthcare-associated infections. This work has suddenly become trendy during the COVID-19 pandemic. I'm here today to talk about infection control in the context of dual infection risks to patients as well as to healthcare professionals. So the first question is, given the current COVID-19 pandemic, what are anesthesia clinicians most worried about? Well, I think infection control is the answer that comes to mind. Now, traditional infection control focuses on reducing cross-contamination between patients. So we focus on hand hygiene to make sure you aren't taking bacteria from one patient to another. We focus on the use of filters to prevent machine contamination from exhaled pathogens so that we don't transfer them from one patient to another. However, the COVID-19 pandemic has really added focus to the problem of cross-contamination from patients to healthcare workers. I actually think this is a great opportunity because efforts that reduce cross-contamination between patients also benefit clinicians. So what are the things that we should be focused on in terms of how to reduce cross-contamination for both clinicians and patients? Well, the first thing, obviously, that's gotten a lot of notice recently is personal protective equipment, or PPE. Clearly, that is very good at protecting healthcare professionals. It also helps to protect patients because you're thinking more about contamination. Hand hygiene remains really important. It protects patients from cross-contamination, but it also protects you from going out and putting those bugs in your face after you take care of a patient. And then reduced contamination of the workspace. How can we reduce the amount of viral load that we have in the workspace that could transfer either to a patient or to a healthcare professional? Another major worry for particularly anesthesiologists is that airway management can be aerosol generating, particularly if a patient coughs during either intubation or extubation or even mask ventilation. Airborne PPE has been shown to be truly effective in preventing infection of healthcare workers. It is also true that the machine can get contaminated on the inside from patient exhaled pathogens. And so concern about contamination of the inner workings of the anesthesia machine ventilator has led to increased focus on and use of bacterial and viral filters to protect the machine from the patient and the patient from the machine. Thanks for watching. This is one of a series of videos on tools for protecting the anesthesia professional and the patient during a pandemic.